is a discipline that emphasizes safety in healthcare through the prevention, reduction, reporting, and analysis of error. The theme for the World Patient Safety Day 2024 is Improving Diagnosis for Patient Safety. The slogan for the day is Get It Right, Make It Safe. Patient Safety Day is observed on September 17 each year to raise awareness of the importance of patient safety. The theme for the 2024 highlights the importance of accurate and timely diagnosis in improving health outcomes and ensuring patient safety. I invite our college choir to sing a prayer song.
By thanking the Almighty for blessing us with the opportunity to gather here today and for guiding us in our mission to provide compassionate and quality health care. On behalf of Dr.Jeyasekharan Medical Trust, it is my honor to welcome you all for the Patient Safety Day Program 2024. Today, we come together to reaffirm our commitment to patient safety and to celebrate collective efforts in creating a safe and caring environment for the patients. It is my pleasure to welcome Medical Administrator Dr.Renu Devaprasath, who worked tirelessly behind the scenes. Welcome, Madam. A warm respondent, Mrs. Beena Sabu, who ensures seamless operations. Welcome, Madam. I'm delighted to welcome our special guest of honor, Ms. Maria Buse here, Clinical Lead in Surgery, Dumfries, UK. Welcome, Madam, for your valuable time. I extend a warm welcome to our chief guest, Dr. Anita Alexis, Associate Professor of Microbiology, Kanyakumari Government Medical College Hospital, whose presence graces this occasion. Welcome, Madam. I extend a warm welcome to Ms. Anju Sabu, IT Consultant, Dr. Jeyasekharan Hospital and Nursing Home. Welcome, Madam. I welcome Consultant Physiatrist, Dr.Subbian E., Dr. Jeyasekharan Hospital and Nursing Home for your expertise. Welcome, sir. I welcome Dr. Jitesh PK, Lab Director, Dr. Jeyasekharan Hospital and Nursing Home for your dedication to accurate diagnostics. Welcome, sir. I warmly welcome Deputy Nursing Superintendent Mrs. Hepzi for your guidance. Welcome, ma'am. I would like to extend a warm welcome to the course coordinator, College of Allied Health Sciences, Mrs. Jayalakshmi, to this occasion. Welcome, ma'am. I would like to welcome the course coordinator, Radiology Department, Mr. Ranjit Singh. Welcome, sir. Microbiology Lab in charge, Dr.Jeyasekharan Hospital and Nursing Home to this occasion. Welcome, sir. I welcome Mr. Kingston, Imaging Department in charge, Dr. Jeyasekharan Hospital and Nursing Home for your precision. Welcome, sir. I welcome Mr. Denzel Anthony, COO, Dr. Jeyasekharan Hospital and Nursing Home to this occasion. Welcome, sir. It is my pleasure to extend a special welcome to all hospital and college staff who are the backbone of this institution. I welcome you all. May the gathering today be blessed with wisdom, insight, and a renewed commitment to patient safety. Thank you, and let us proceed with today's programs. Thank you.
Good afternoon, everybody, and thank you for this opportunity. So, today is a very important day because patient safety and patient care is our business and the reason for us being in this hospital. So I'll just start with a little introduction because, as you know, we have speakers who will cover their own domains and bring forward points which you can carry back home. And this year we are talking about improving diagnosis for safety. Now this hospital was begun way back in 1965. And Dr. Jeyasekharan and Mrs. Jeyasekharan, both of whom have passed on, left a legacy. And that legacy not only included these buildings, but there was a patient safety culture. So all those who would have worked with Dr. Jeyasekharan will recall how every day was a patient safety day. And everything that we did revolved around patient safety. Now, the world, internationally, they're talking about patient safety. And they came up with these 7 safety goals. Okay? So, they said the first thing is the identity of the patient. That you must always use 2 identifiers to identify your patient. Just the name alone is not at all sufficient. It is very dangerous. Because you must realize that the hospital environment is the most dangerous place on earth. You can't be in greater danger than being in a hospital. Because so many things can go wrong. They do not go wrong if you take care. So our endeavor is to make sure that we are taking care. So, identify patients correctly. Effective communication. It is communication with the patient to know what is troubling him, communication with doctors, communication with nurses, communication in handing over. Communication is the backbone. Improving the safety of high alert medications. So, those medications, just suppose heparin. If by chance somebody gives 25,000 instead of 2,500, a calamity, right? So such medications definitely 2 people need to check out. Then ensuring safe surgery, which has now become so good because of a safe surgery checklist, which was introduced many decades ago. And how many people read the checklist manifesto? There's one book written by Arun Gwande, who created the safe surgery checklist. It's a beautiful book. It tells you how checklists need to be so simple that they can be followed. And where do we come across the best checklists? Inside the aircrafts. So your flying is so safe because of checklists. Reducing the risk of hospital-associated infections. So that's where our hand hygiene and our hospital infection control nurses, and our chief guest specialty, microbiology, comes into the picture. Reducing harm associated with clinical alarms. You may not even realize what harm can take place when an alarm goes off. Because if you do not set the alarms for that particular patient, it will not only disturb other patients, it will take away valuable time from nursing, it will take away time from doctors' work, all kinds of things will happen. So it's very important to reduce patient harm associated with clinical alarms. And then, of course, preventing mistakes in surgery, which is about the training program. So how can we make patients safe in this very dangerous environment? And that can happen only if every individual who takes care of patients does their own duty, their own job well. So there is no job which is bigger than another job. In the hospital, everybody's job is important. The sweeper's job is so important. The assistant who's transferring the patient, pushing the trolley, their job is so important. So if everybody does their job very well, patients will be safe. So the principles to remember to ensure patient safety would be, please understand the patient's problem. So the nurse takes a history, the doctor takes a history. Why have they come to you? Unless you address that issue, the patient will not be happy. So understanding the patient's problem, then doing the clinical examination, noting down what is the problem, then doing relevant investigations, so that the investigations are only those which will make a difference to the management of the patient. And then those investigation results should be interpreted by the person concerned, and the clinician should take action, and then continuity of care through reviews and communication and documentation. So this is just an introduction to patient safety. And now I'm going to hand over to a very special doctor. So we are privileged to have a physiatrist in our hospital. Every hospital does not have one, believe me. I think south of Vellore, you may be the only one, Dr.Subbian. So over to you, because he will cover the 6th WHO goal of patient safety, which is prevention of falls.
Thank you, Doctor, for your insightful introduction. Your clear presentation provides an excellent foundation for the rest of the session.
Hello, thank you, and good afternoon, everyone, students, staffs, and especially all administrators, and thank you for being here. So I'll just, today is the World Safety Health Day. As a modern world, we are a lot of mechanization, automation, machines, a lot of things are happening. As a human being, we have to be safe, not just outside the civil area, as well as in the hospital too, which is a very big thing. So WHO came with all the 6, now it's become 8, 9, it will keep on going. But the 6 is the when they started with. So this is first is to improving the diagnosis for patient safety. So 6th one is mainly to prevent fall or any harm. So let us all stand up to prevent fall. That's a slogan I have put it in. No, I may be little plagiarized it from somewhere else, but I'm no harm in doing that. Okay, thank you. So when 100 years ago, one doctor and a few nurses is enough to see a patient. Now as the science has advanced, each one doctor has an organ and they'll be taking care of it. So we all have to work as a team, like in space science or in automobile or air industries. We are there, we are almost there, but not yet. But we have to strive hard to have the teamwork with dedication. Even though automation, mechanization, a lot of machines have happened. So let's go to the next one. The patient go through a phase of disease. The disease can affect any organ. Then if we not establish a diagnosis as soon as the patient comes in, the chance of increase in disability is quite high. And all the medical and surgical aspect of the specialties take care of each organ and establish a diagnosis, understand, come to a conclusion, and thereby we can decrease the disease. Thereby we can decrease the incidence of death. Okay, I have to put that word death, sorry, because we did in day F, we see that, right? So the error is 16 to 18%. That's the error which is come up with WHO. I'm glad to say in Dr. JMT, the sixth goal is certainly less to a certain extent because the hospital is evolved over the period of 60 years. So even though infrastructure is appropriately designed for the disabled patients or elderly patients, or if any patients to come in and go out, I'm glad we have a lot of trees around the building. That's very important because most of the modern buildings are all one big box with a centrally air conditioned. We don't get a view, even greeneries. And slowly we are coming there, all the hospital architecture, we are bringing the green in, which soothes the patient's sensory input and thereby decrease a lot of anxiety also. So the types of fall is accidental fall. Accidental fall is once we identify the low risk person who can walk in, have a slip and can have an accidental fall, like wet floor, slippery mattress or thing. And the next one is anticipated fall. The anticipated fall is the high risk patients. We know they are going to fall. So we have boards, checklists, education pamphlet, which has been going through, some sort of awareness is going on. The next one is unanticipated fall. The patient can have the pre-event like MI or a stroke or a hypoglycemia. They will be in a pre-clinical status. They will get admitted. They can have the event in the hospital and have a fall. So that is unanticipated fall. The psychological fall is what mostly the psychological anxiety of the staff along with the patient can trigger a series of psychological fall. Apart from the depressed and anxiety patient, they can jump and have a fall also. So that part is very important. The staff has to remain really calm, including doctors, when they transfer the patients from various level, whether they are doing their activities of daily living. Some of the time, especially in the night, when the elders, they want to go to restrooms, so they'll be in a hurry. They don't want to wet the bed, bedwetting, which will cause a lot of social anxiety for them. So that's the time most of the fall happens. Early morning, so that can be prevented. You can educate the person this can happen. They know that. The patient doesn't mean they don't know. They know that, but still it can happen. Okay. So the elderly, as they go through the period of time, physiologically there is a decline. Okay, it's not a disease. Physiologically, certain aspect of it declines, and certain diagnosis can happen organ-wise, musculoskeletal-wise, and central nervous system-wise. So everything slows down for them. So the gait changes. The step slows down. The width becomes wider for men, and for women it becomes narrow. So basically they have to hold their center of gravity. They cannot hold the center of gravity. When they are in anxious, we know the high risk, but when they are anxious, the fall can trigger. Usually before fall or any trauma, even road traffic accident, there are studies shown last 2 weeks prior to that, there are some sort of, something happened to trigger their things. Like we cook every day, sometimes we cut our fingers because sometimes we take bath every day, we slip. So same thing can happen. So 2 weeks before, something has happened to put us in a disarray mentally. That's why it triggers all those things. So how to prevent fall? Fall is very multifactorial, multidisciplinary aspect. It's not one person took responsibility. Anyone in the hospital can make sure that they prevent fall, especially the stakeholders are patients, family, healthcare provider, healthcare leaders, society, policy maker, and of course politicians in the social aspect of it, like in railway stations, bus stands, aeroplanes. Most of the countries in the developed world do have. We are there, but we're still not there. The railway has done a good job to prevent for elderlies to go around. Bus stands are still iffy, but in a hospital setting, like I said, Dr.Jeyasekharan Hospital, to a certain extent, we have that. It has evolved over the period of time. So the other one is to review and modifying the medication in conjunction with all the specialists, and especially the medication which affects for the pain and other things can cause a lot of balance in coordination issues, thereby it can trigger fall. So how to prevent fall? One is to, from the patient point of view, we can give them an exercise program to improve their balance and their coordination and posture. And I found out the Asians in the East Asia, especially Japan, Korea and China, they do Tai Chi, and of course we do yoga here. So I'm not going to claim the fall is less there or here, but they seems to be adapting much better. And it has to do with their food also, unlike the subcontinent groups. So one is to modify the environment, which is very important, and that's where the occupational therapist comes into the play. They can do a good home eval and see how the home can be modified. And that has a very strong evidence, occupational therapists, and this is in 2001 itself they have done that. So they can do the evaluation of the activities of daily living and the home evaluation and how to modify the home. A lot of gadgets are there, a lot of technologies are there, is to help them to be independent and to do that. Okay. But the simple one is to something called independent living aspect of it. You can give a cane or a quadruped or a walker rather than going a high-tech, assistive technology devices. And so other one is to prevent osteoporosis, because when they fall, they can break the bone. So sunlight exposure, vitamin D, and also weight-bearing activities, standing for a few minutes over the period of time for the elders can prevent the osteoporosis. And I want to mention this, which is we don't talk about it, is elders abuse from the self-harm can happen from them and the relatives, caregivers. So we have to look for marks, whether they've been abused. If not physically, emotionally, certain words can, even we can say a few words which can emotionally harm them. So we have to be very selective about the words which we talk to them. And they are also human beings. We've been protective for over a period of life for themselves, family, and the society, and they've they deserve to be looked after. So there are a lot of things. So we are from here to here. A lot of things are happening to improve their. That we can program the cells to slow down and to slow down the aging and to age wisely. So conclusion, and not just physical medicine, rehab and psychiatry is a whole medical specialty. Nursing plays a huge role. I always say 90% is nursing and 10% only doctors does it. So nursing plays a huge role. And the physiological, psychological support should be there. I'm going to skip this, it may take time. There are a lot of assistive devices that have come to support them because there are lack of humans. The machine can take care of, this is given for emotional support, this is for ADL support. But compassion, that's the one thing no machine is ever going to have, even though if they are going to have, it's a synthetic, it's not organic. Perhaps that's the only thing keeping us ahead of them. Thank you.
Morning, we have all gathered here, and it is good afternoon. Okay, so am I audible? Yes. I owe my grateful thanks to Dr. Devaprasath Madam for having invited me to be the chairperson of today, this August gathering. I thank the organizing team for this, celebrating this day. Can we have the lights on? Don't want the presentation. I have not prepared any slides. It's a matter of 5 minutes talk. As you all know, everybody is aware of many things. I just want to put forth certain questions. What are we celebrating today? Students, what are we celebrating today? World Patient Safety Day. What is patient safety? Okay. It is a health care discipline. It is not somebody's who can want or do not want. It is a discipline that has emerged because of complex healthcare services we are giving. Dr. Subbian said before 100 years there were only few patients, few doctors, and the doctor was a whole-time medical practitioner. He knows everything about the patient. Today the conditions have changed. There are a lot of complexities and so many health risks have evolved because of our healthcare complexities. And we have to be aware of that, and we have to give safe health to the patients. What is the fundamental of being a healthcare service person? What is the fundamental of providing healthcare? First, do no harm. Yes? First, do no harm. So the key facts when we are in this institution or when we are working to provide healthcare safety or healthcare for the patient, we must be aware of certain statistics. It says that 1 in every 10 patients are at risk of developing a injury or harm. And a good point about it is above 50% of these risks are preventable. Thanks. We are glad. Preventable. And as enlightened by Dr. Renu ma'am, we know the different adverse effects in the hospital, adverse events in the hospital. All of us as nurses, paramedicals and the doctors and the teaching staff, we must be aware that so many adverse events are there. And medication error is the highest, fall, then healthcare associated infections, then unsafe surgical procedures, unsafe blood transfusions, etc. And this year's theme highlights about the diagnostic errors. So what is the theme of this day? What is the theme? It's written there. Yes? So the WHO has been seeing all this, and they have come out with the resolution of celebrating or observing patient safety, and this has landed up, and it started somewhere in May 2019, and it is resolved to be celebrated on September 17th of every year. So for past 5 years we have been celebrating, and this is the 6th year or 5th year I think. So 2019 they said patients safety is the health service priority. And now another question, what happened in 2020? COVID, there was a pandemic. And then WHO analyzed and said healthcare persons, health workers' safety is patient's priority. Yes, health workers' safety. If the health worker is safe, he can save the patients. That is how it came up in 2020. It observed newborn and respectful maternal safety. And then 2021 regarding medication safety, and 2022 like that it went on. And this year it is resolved because it resolved it as the theme is improving diagnosis for patient safety. Do we all agree with that? What is a diagnosis? What is diagnosis? So, it is identifying the patient's health problem, and it is the key to care and cure. Yes? Do you all agree? We have to identify first. The right diagnosis has to be made before we start the treatment for the patient. And so the WHO and the World Health Assembly is making us come forward to make a correct diagnosis and improve our diagnostic patterns. So the diagnosis mainly lays on 3 important aspects, namely the lab tests, imaging tests and the biopsy, which gives a clue for the treatment. So this has to be safely done and ensure safety in all these ways. If the diagnosis is not proper, the improper diagnosis can be missed diagnosis or delayed diagnosis or incorrect diagnosis. the patient's safety is at risk. Okay? So statistics say 1 in every 20, there are about 1 in every 20 patients' diagnostics tend to go wrong. 1 in 20 diagnostic tests. This is the statistics. I am not saying out of my own knowledge. I just referred and I came back and say 1 in every 20 diagnostic tests we do goes wrong. So where do we stand? Where do we have to empower ourselves to be on the right path? And then this leads to patient's harm. So in all this, so in further, what does the WHO plan? That is, the World Health Assembly has a plan, annual patient safety plan, which extends for 10 years. Say from 2021 to 2030, it has a plan and it has got various objectives, like, objectives which says raise awareness for patients' diagnosis and integrating this diagnosis with the clinical outcome and the treatment. And then emphasize the pivotal role of correct and timely and safe diagnosis. Then action plans have to be made to include diagnostic policy with the patient's safety policy. And then foster collaboration. So these are all the plans what the WHO is emphasizing on us. Foster collaboration between the administrators, the healthcare policy makers, and the healthcare providers for patient safety. Okay? And then emphasize or empower the patients and the family to integrate with the healthcare workers, healthcare providers, to give them better, safe diagnostic ways. So these are the message I wanted to give. And at this juncture, I facilitate Dr. Jeyasekharan Hospital and Nursing Home for implementing all the policies and plans as and when the WHO has put forth. I am very happy and I am very honored to say this today. So we try to grow to the level of implementing whatever the plans and the policies the WHO is putting forth every time. And I am very honored and I am very happy to be a part of this team in this hospital as a staff. Thank you for this opportunity. Thank you.
Good afternoon to everyone. I am the lab director here and my name is Dr. Jitesh. So as we all know, today we are actually celebrating the World Patient Safety Day. So it's an initiative by the WHO to raise public awareness and to foster the collaboration between the patients, health workers, and the policy makers, mainly to improve the patient's safety. And this year's theme is to improving the diagnosis for patient safety, with the slogan being "Get it right and make it safe." Which emphasizes the importance of the correct and timely diagnosis to ensure the utmost patient safety. So what is the diagnostic process? So it's a teamwork, and it's a collaboration among the pathologists, the technicians, the microbiologists, the biochemists, the radiologists, and the clinicians, including the physicians, surgeons, and other diagnosticians. So and the key is to do the right diagnosis, which is the most important aspect of healthcare. So what can be the harmful effects of any diagnostic error? So it can obviously lead to plenty of negative health outcomes. Most importantly, there will be inappropriate or unnecessary treatment which can be given to a patient, and also they can be appropriate and potentially the life-saving treatment could be withheld or delayed, which is actually even more dangerous. It also can lead to much psychological distress and eventually leading to financial burden on the patient, and ultimately it can also lead to loss of the lab's credibility in the long run. Yeah. So stats say that most people will experience at least one diagnostic error in their lifetime. Sometimes that with devastating consequences. National Patient Safety Foundation poll has found that approximately 1 in every 6 people surveyed had experienced with a diagnostic error either personally or through someone they know. Another 2015 survey in the US stated that almost a quarter of all the people say that someone close to them or they themselves had experienced a medical error, and in that too approximately half of those were actually diagnostic errors. So how do we improve the lab diagnosis? So basically any diagnosis will have 3 phases. First being the pre-analytical phase, then analytical phase, and then the post-analytical phase. So pre-analytical means all those things that happen before the actual test is being done in the lab. So when starting from is the patient identification. So it's imperative that to identify the exact correct patient who needs the test. We should not actually change the patient in the ward or in the OP when we do the sample collection. And then comes the selection of specimen type. So we need to be aware of what specimen do we exactly need. If it is a blood or urine, and in the blood also what do we need? Is it a EDTA sample, or it's a serum sample, or it's a plasma sample in that way? And even for urine also, which sample do we exactly need? Is it a random urine sample, or a first morning urine sample, or a midstream sample, or a catheterized sample, or a 24-hour specimen? So we need to be aware, and we should have enough knowledge as to what to exactly select. And then the next comes the specimen collection. So this is again a very important aspect as to how to identify the vein to puncture, and the way to tie the tourniquet, and which sample to take, how many ml sample to take. So the concerned phlebotomist should be aware of all these things and should be adequately trained as well. Next comes the specimen labeling. So again, this is where the most common number of errors do happen. Even yesterday there was a case in the post-op ward where actually 2 samples came and the label was intermixed. So thankfully our biochemistry staff actually found out the error, and we informed them back, and then we got the correct samples back, and the right report was issued after that. Then comes the transport of specimen. So this is also actually very important. For example, in case of CSF, so as soon as the LP is done, the sample should reach the lab at the earliest, because the more you delay it, actually the cells will start to disintegrate. So the count will be lower if you do the test afterwards. So it can actually lead to false negative outcomes in the CSF report. So coming to the actual analytical phase, so compared to how it was some 20 odd years ago, nowadays we are actually much more dependent on the machines rather than the manual work. So compared to how it was earlier, we are actually doing much less manual work. So it's imperative that we maintain and calibrate all our instruments so that they work with utmost effectiveness. So it also use actually standard controls for all the test procedures. We should also do regular quality control every day, thrice every day. Should also follow appropriate SOPs for all the test procedures, and also do all the correct techniques for aliquoting, pipetting, dilution, all those things. And the post-analytical care. So in this phase, actually the most important component is actually critical values. So what's the critical value? It is defined as any test result that requires immediate clinical attention to avert significant patient mortality and morbidity. So ideally we inform it verbally to any member of the healthcare team responsible for that particular patient. And so in our hospital, we follow, what we do is we usually inform to the primary physician within 15 minutes, rather at the earliest we inform. We inform as soon as the result is available to us. So if the primary consultant is not available, we inform it to the ward duty doctor and the staff nurse in that particular ward. So you also maintain everything, as in the time the result came, the time informed by whom, and whom it was informed to, and have they read back or not, like that. So it is actually a leading quality indicator for a post-analytical phase. So we follow 5 main steps, that is check, confirm, call, ask for feedback, and document. check and confirm is, we have to check if it is actually a critical value indeed or not. So, before informing, we always confirm the result in our hand. So that then we inform the concerned doctor and ask for a readback from them, and then eventually we document everything in our critical entry register. So how do we maintain assure the utmost quality of a lab? So we do it by development, implementation, and regular monitoring of all the SOPs which we follow. So we also have to employ only the trained and experienced staff in our labs. We also need to conduct regular training programs for all the staffs in our labs, and also we have to only procure the wild instruments and also do regular maintenance and calibration for all the instruments in our lab. And eventually we also have to monitor whether the results are being reaching the patients and doctors as early as possible or not, so that the treatment is not delayed further. And we also have to participate in external quality assurance program, commonly called as EQAS. So basically, quality control. So what's quality control? Quality control is the systematic monitoring of all the analytical process in a lab through the use of control samples to verify the accuracy and the reproducibility of the lab results. So we actually have two types of quality control: internal and external. External is shortly called as EQAS, external quality assurance schemes. So what they do is basically test the proficiency of any lab who do EQAS. So our lab currently we are actually participating in so many such EQAS programs. We are a part of the CMC EQAS program for our lab test like coagulation studies, biochemistry, hormones, enzymes, all these things, and also microbiology as well, and the blood bank too. And for hematology, we are a part of AIMS New Delhi EQAS, and for histopathology, we are part of NCG EQAS, which is a program run by Tata Memorial Hospital. And NCG is actually the National Cancer Grid. So we have been a part of that program for the past 1.5 years now. Yeah, thank you.
Good afternoon, everyone. Special thanks to Dr. Renu, Mrs. Beena Sabu, Mrs. Jayalakshmi, and Nursing Service for this opportunity give me. So, Dr. Renu சொன்னாங்க, in 1965 ஹாஸ்பிட்டல் தொடங்கின அன்னையிலிருந்து பெரியவருக்கு all days are patient safety day. But WHO September 17th World Patient Safety Day ன்னு சொல்கிறாங்க. அந்த World Patient Safety Day theme improving diagnosis. Improving diagnosis for patient safety, aim correct and timely diagnosis. கரெக்ட் டயக்னோசிஸ் பண்ணால் பேஷண்ட்டு நம்ம எவ்வளோ தூரத்தில் பேஷண்ட்டுக்கு நம்ம ட்ரீட் பண்ணி பேஷண்ட்டை டிஸ்சார்ஜ் பண்ண முடியுமோ அவ்வளவு சீக்கிரத்தில் அத்தனை நாளைக்கு முன்னாடி நம்ம பேஷண்ட்டை சீக்கிரமாக வீட்டுக்கு அனுப்பிடலாம். டயக்னோசிஸ் கன்ஃபார்ம் பண்ணாமலே ப்ரொஃபஷனலி டயக்னோசிஸ்லேயே சில பேஷண்ட்டு ஒவ்வொரு டெஸ்ட்டும் பண்ணி டயக்னோஸ் பண்ண முடியாமல் 2 or 3 days டயக்னோசிஸ்க்காக வேண்டிய பேஷண்ட் வெயிட் பண்ணக்கூடிய சூழ்நிலை சில நேரத்தில் மாட்டிக்கிடும். அப்படி இருக்குச்சில இப்போ இந்த டயக்னோசிஸ் பர்பஸு இந்த இமேஜிங் டிபார்ட்மெண்ட்டு மோர் தென் 70% டயக்னோசிஸுக்கு ஹெல்ப்பாக இருக்குது அப்படின்னு நான் சொல்லுவேன். தி ரேடியாலஜி டிபார்ட்மெண்ட் இஸ் த பேக் போன் ஆஃப் கிளினிஷியன்ஸ் அப்படின்னு சொல்லுவாங்க. அதனால் அந்த ரேடியாலஜி டிபார்ட்மெண்ட் பேஷண்ட்டுக்கு எவ்வளவு சேஃப் கொடுக்கணும்னு தான் நான் சொல்ல போகிறேன். பட்டு ரேடியாலஜி ionizing radiation is very harmful for the human body. So அதுலேயும் இந்த ஏர்லி ப்ரெக்னென்ட் லேடிஸ் ரேடியேஷன் நம்ம கொடுத்தா ஓஜி டாக்டர்ஸ் அட்வைஸ் பண்ணுறது தெரியாமல் எப்படியாவது நம்ம ஒரு எக்ஸ்ரே எடுத்துட்டோன்னா இதை அபார்ட் பண்ணுங்க இந்த ஃபீட்டஸ் அப்படின்னு சொல்லக்கூடிய அளவுக்கு வெரி டேஞ்சரஸ் இன் ionizing radiation for early stage of pregnant ladies. So நம்ம ஹாஸ்பிட்டலில் என்ன செய்கிறோன்னா, நம்ம வந்த உடனே இந்த சைல்ட் பியரிங் ஏஜ் அப்படின்னு ஐடென்டிஃபை பண்ணி வச்சுருக்கிறோம். 17 to 45 இயர்ஸ் லேடிஸ் எக்ஸ்ரேக்கோ சிடி ஸ்கேனுக்கோ வந்தாச்சுன்னா மேமோகிராஃபி ஓபிஜி நம்ம அயனைசிங் ரேடியேஷனை பயன்படுத்தி பண்ணக்கூடிய இன்வெஸ்டிகேஷன் எக்ஸ்ரே சிடி ஸ்கேன் ஓபிஜி அண்ட் மேமோகிராஃபி. ஸோ அந்த பேஷண்ட் வரும்போது நம்ம பேஷண்ட் ஐடென்டிஃபை பண்ணுறோம், பேஷண்ட்டிட்ட கேட்குறோம் அவங்க எல்எம்பி டேட்டு, மற்றபடி கன்சீவாக இருக்கிறாங்களா, எத்தனை டேட் அவங்களுக்கு லேட்டாக இருக்குது அப்படின்லாம் கேட்டு இந்த ஃபார்ம், இந்த கன்சென்ட் ஃபார்மில் நம்ம அவங்கள்ட்ட கையெழுத்து வாங்கின பிறகு தான் நம்ம என்ன செய்கிறோம், அவங்களுக்கு ரேடியாலஜிக்கல் ப்ரொசீஜர் பண்ணுறோம். இது நம்ம முக்கியமாக கொடுக்கக்கூடிய ஒரு சேஃபு. அதன் பிறகு அல்லாரா ப்ரொசீஜர் அஸ் லோ அஸ் ரீசனபிள் அச்சீவபிள். பேஷண்ட்டுக்கு நம்ம எத்தனை ஒரு இன்வெஸ்டிகேஷன் பண்ணுறதுக்கு எந்த அளவுக்கு ரேடியேஷன் கொடுக்கணுமோ அந்த அளவுக்கு மட்டும் ரேடியேஷன் கொடுத்து ஒரு குட் குவாலிட்டி ரேடியோகிராஃபை கொண்டு வரதுக்கு, குட் குவாலிட்டி ரேடியோகிராஃப் கொண்டு வந்தால் தான் டாக்டர்ஸுக்கு டயக்னோஸ் பண்ணுறதுக்கு ரொம்ப ஈஸியாக இருக்கிறோம். அதை வச்சு பார்த்தா இல்லைன்னா பேடு ரேடியோகிராஃபி அவங்களுக்கு டயக்னோஸை மாற்றி விட்டுரும். ஒரு சின்ன பிள்ளை டில்ட் ஆகியிருந்துன்னா ரைட் சைடு லெஃப்ட் சைடு ஆகும். அப்படி இருக்கும்போது நிமோனியாவா அது டில்ட்னால் வந்த இதா அப்படிங்கிறதெல்லாம் பார்க்குறதுக்கு ரொம்ப கஷ்டம் இருக்கும். அது ராங் டயக்னோஸ் வழி வைக்கும். ஸோ நம்ம நீட்டாக ஒரு ரேடியோகிராஃப் பண்ணுறதுக்கு ப்ராப்பராக பேஷண்ட்டுக்கு டேஞ்சரஸ் இல்லாமல் கொடுக்கக்கூடிய அந்த ஃபேக்டர்ஸ் ரேடியேஷன் கொடுத்து நம்ம ஒரு இது பண்ணுறோம். அதன் பிறகு ஒரு இது வந்து கிரிட்டிக்கல், எந்த ரிப்போர்ட்ஸ் வந்த உடனே நம்ம ஹாஸ்பிட்டலில் மெயின்டைன் பண்ணக்கூடிய கிரிட்டிக்கல் ரெஜிஸ்டர், ஒரு கிரிட்டிக்கல் கொஞ்சம் டயக்னோசிஸ் நம்ம பண்ணி வச்சுருக்கிறோம். அதன் பிறகு இந்த லேடிஸ் வந்துச்சாங்கன்னா, ப்ரெக்னென்ட் லேடிஸ் யாராவது வந்தாங்கன்னா இதே போல் ஒரு டிஸ்பிளே சைனேஜ் போர்டு, எல்லா அயனைசிங் ரேடியேஷன், அது கேத்லாபாக இருந்தாலும் சரி தான், ஓபிஜி மிஷினாக இருந்தாலும் சரி தான், மேமோகிராஃபாக இருந்தாலும் சரி தான், சிடி மிஷின், எல்லா வாசல்லையும் நீங்கள் ப்ரெக்னெண்ட்டாக இருந்தால் உடனடியாக சொல்லுங்கள் அப்படிங்கிறக்கூடிய ஒரு இதை போட்டி வச்சுருக்கிறோம். தென் கிரிட்டிக்கல் ரிப்போர்ட்ஸ் வந்துச்சுன்னு சொல்லியாச்சுன்னா உடனடியாக ஒரு வித்தின் 5 minutes டாக்டர்ஸ்கிட்ட நம்ம என்ன செய்கிறோம், அந்த ரிப்போர்ட் இந்த பேஷண்ட்டுக்கு இந்த எக்ஸ்ரே எடுத்தது அல்லது சிடி பண்ணது யூஎஸ்ஜி பண்ணதில் இந்த கிரிட்டிக்கல் ஃபைண்டிங்ஸ் இருக்குது, ஸோ அதை நீங்கள் உடனே பாருங்கள் அப்படின்னு சொல்லி இன்ஃபார்ம் பண்ணுறோம். தென் கொஞ்சம் கிரிட்டிக்கல் டயக்னோசிஸ் போட்டு வச்சுருக்கிறோம். பிளைன் எக்ஸ்ரேல ஹாலோ வெசரல் பெர்பரேஷன், ஃப்ராக்சர்ஸ், இன்டெஸ்டைனல் அப்ஸ்ட்ரக்ஷன், லங் கொலாப்ஸு, நீமோதொராக்ஸு, massive pleural effusion, pericardial effusion, pulmonary edema, malrotation, large obstructive VJ calculus, bilateral ureteric stones, the CT brain at the acute infarct, hemorrhagic transformation of infarct, hemorrhagic due to trauma, aneurysm, ruptured hemorrhage, hydrocephalus, SOL, pneumothorax, hemothorax, collapse consultation, pulmonary embolism, septic embolism, effusion, aortic dissection, intestinal obstruction, trauma, aneurysm, portal vein thrombosis, ischemic colitis, extremities, fracture and dislocation. Ultrasound scanning la ectopic pregnancy, fetal distress, retroplacental clot, cervical incompetence, ovarian torsion, interception, acute arterial thromboembolism, portal vein thrombosis, testicular torsion, intracranial hemorrhage in newborn தான் அல்ட்ராசவுண்டில் இன்ட்ராக்ரானியல் கண்டுபிடிக்க முடியும். லார்ஜ் ஹைட்ரோசெபலஸ் இன் நியூபார்ன், சால்டரி கிட்னிஸ் வித் அப்ஸ்ட்ரக்ஷன், பெரினெப்ரிக் ஆப்சஸ், அனிரிசம், எக்ஸ்ட்ராவேஷன் ஆஃப் யூரின், ஃப்ராக்சர் பீனிஸ், ட்ராமா, இன்டெஸ்டைனல் அப்ஸ்ட்ரக்ஷன், ஸ்ட்ராங்குலேட்டட் ஹெர்னியா. Mammogram, some critical findings for breast cancer are on a mammogram include calcification, lumps with irregular shapes, jagged outlines or other unusual features are more concerning and may require additional testing. Architectural distortion, this is a mammography finding that can indicate breast cancer. So இப்படிப்பட்ட இது கண்டுபிடிச்சு நம்ம ஃபைண்டிங்கில் வந்துச்சுன்னா உடனடியாக கன்சர்ன் டாக்டர்ஸ் கன்சல்டண்ட்டுக்கு நம்ம உடனே இன்ஃபார்ம் பண்ணுறோம். வித்தின் 5 மினிட்ஸில் அதான் அந்த ஃபஸ்ட்டு நான் சொன்ன அந்த ரெஜிஸ்டரை பார்த்தா தெரியும் என்ன ஃபைண்டிங் வந்திருக்குது, அது யார் ரிப்போர்ட் இன்ஃபார்ம் பண்ணியிருக்கிறா, யார்கிட்ட போட்டிருக்கான்னு சொல்லி உடனடியாக பேஷண்ட்டுக்கு ஒரு ட்ரீட்மெண்ட் கொடுத்து ஒரு இப்போ சிடி ஸ்கேன் பண்ணுறதுல ஒரு இன்ஃபாக்டோ ஒரு ஹெமரேஜோ வரக்கூடிய பேஷண்ட்டை உடனடியாக சேவ் பண்ணக்கூடிய அளவில் அந்த அளவுக்கு நம்ம இது பண்ணி வச்சுருக்கிறோம். அன்னெசரியாக யாருக்குமே நம்ம ரேடியேஷன் கொடுக்கல, அந்த அளவுக்கு நம்ம ரேடியாலஜி டிபார்ட்மெண்ட்டில் ஒரு நல்ல ஒரு சேஃப் பண்ணி வச்சுருக்கிறோம். மற்றபடியும் அதை கோல்டு பண்ணுறதுக்கு யாராவது பேஷண்ட் அட்டெண்டன்ஸ் வந்தாங்க கூட அவங்களுக்கும் சேவ் பண்ணுறதுக்காக வேண்டி அயனைசிங் ரேடியேஷன்லேருந்து அவங்களுக்கும் சேவ் பண்ணுறதுக்காக வேண்டி அவங்களுக்கும் பிபிஇ அதாவது ஏப்ரான்ஸ் அதெல்லாம் கொடுத்து தான் அவங்கள கோல்ட் பண்ண சொல்கிறோம். இப்படி பேஷண்ட்டு சேஃப்டி நம்முடைய ரேடியாலஜி டிபார்ட்மெண்ட்டில் மெயின் பார்ட்டாக எடுத்து பேஷண்ட் சேஃப்டியில் அயனைசிங் சேஃப்டியும் அவங்களுக்கு கண்டிப்பாக நம்ம கொடுக்கணும் அப்படின்னு சொல்ல ஒரே ஏமோட அந்த அயனைசிங் ரேடியேஷன்லேருந்து பேஷண்ட்டை காப்பாற்றுறோம். உடனடியாக ஒரு டயக்னோஸ் பண்ணி டாக்டர்ஸுக்கு முதுகெலும்பாக துணை நின்று யூஎஸ்டியாக இருந்தாலும் சரி தான், அது சிடியாக இருந்தாலும் சரி தான், எக்ஸ்ரேயாக இருந்தாலும் சரி தான், ஒரு ஃப்ராக்சர் பேஷண்ட் இருந்தாலும் உடனடியாக ஒரு எக்ஸ்ரே எடுத்து டாக்டர்ஸுக்கு மிகவும் உதவியாக நம்முடைய டயக்னோசிஸ் டிபார்ட்மெண்ட் இமேஜிங் டிபார்ட்மெண்ட் செயல்படுகிறது என்பதை சொல்லிக்கொள்கிறதில் நான் பெருமைப்படுகிறேன். இந்த இதை தந்ததுக்கு உங்களுக்கு எல்லாருக்கும் ஒரு நன்றியை தெரிவித்து முடித்துக் கொள்கிறேன்.
First of all, I thanks to Dr. Renu, Medical Administrator and Nursing Services for giving these opportunities. Good afternoon to everyone. Introduction. In October 2004, WHO launched a patient safety program in response to pay attention of problem of patient safety. The meaning of patient safety, the prevention of harm to patients. That is, patient safety is the absence of preventable harm to a patient during the process of healthcare inside the hospital. This is a safety cycle. If there is a problem or any issues will happen, we have to focus on evaluate that issue mainly by this safety cycle. First, we have to measuring the harm, then understanding the underlying causes, then identifying the immediate solutions, then evaluating the impact, then translating evidence into safer care. There is 8 international patient safety goals are there. Let's see one by one. The first goal, the identify patients correctly. In patient identification, before doing any procedure to the patients, every staff should realize whether this patient is or not. For that, we have to using 2 identifiers, that is patient full name and the medical record number. These 2 should be checked on the patient wristband, and another one is on the patient admission chart. Before doing anything, before giving medication, before starting IV line, or before doing oral fluids, any procedure, before doing anything, we should follow the patient identification by using 2 identifiers. Is very, very important. The next, the improve effective communication. This is also a very important goal. The hospital develops and implements a process to improve the effectiveness of verbal and telephonic communication among the caregivers. In verbal and telephonic communication, staff should follow the readback policy and confirm that instruction, then only we have to do. The hospital develops implement process for reporting critical results. The timely reporting of the critical value results is very, very important. Then hospital develops and implement process for handover communication. For this handover communication, we are following the ISBAR tool. This shows the ineffective communications. For example, reporting critical test results. The potassium result was reported by lab staff to nurse. The nurse hears result as a very low value of 2.7. After the patient's laboratory results are entered on the screen, it was seen as 8.7. So here we need to follow the readback policy and confirm that critical value. So the effective communication is very, very important while doing the nursing care and other treatment. Then improve high alert medications. This is the third goal. Every staff should know what are all comes under high risk medications first. Adrenaline, atropine, all high risk medications, soda bicarb, calcium gluconate and all. So the staff should aware of the high risk medications list and should know the actions, side effects and the frequency of medications and dosage should be known. So before giving the high-risk medications, the 2 staff should be involved. So the staff should check the doctor's order, then the dosage, route and all. Then before giving, the main thing is dilution. The dilution before administration is very, very important. Then storage, then after giving the medication, the staff should close monitoring the patient at least 15 minutes. This will be reduce the high medications. This will enhance the medication safety. Okay, before giving the medication administration, the staff should follow the 10 rights. The right patient, right medication, right dosage, right frequency, right route, right time, right documentation. Nowadays, a right to refuse the treatment also. Then right evaluation. Then 4th goal, ensure correct site, correct procedure, correct patient surgery. In order to enhance the safe surgery, mainly 3 universal protocols. One is surgical site marking, then preoperative verification process and timeout checklist. That is safe surgery checklist. It was done in theatre. That is before induction of anesthesia, then before skin incision, before patient leaves from the operation room. In anesthesia, before induction of anesthesia, the patient identification, surgical site, surgical procedure to be performed matches the consent, site marking, then known any allergy history, patient positioning, the essential imaging is available or not. These are all checked before the induction of anesthesia by the theatre team. The before skin incision also, the timeout, we say, it everyone ready to perform the timeout, please state your name and role, the patient name, surgical procedure to be performed, surgical site, essential imaging is available also. Then before patient leaving from the theatre, operation theatre, the counting of the instruments, the needle count, the name of the procedure performed, these are all done by the theatre staff. This can be enhance the patient safety. Then 5th goal, reduce the risk of healthcare associated infections. So what are all comes under the healthcare associated infections? We know CORTI, SSI, phlebitis, VAB, then pressure ulcer. These are all comes under the healthcare associated infections. In order to prevent these infections, we are following the HIC guidelines, mainly proper hand washing, hand rub, follow the 5 movements and follow the aseptic precautions. Then only we prevent these healthcare associated infections. Then reduce the risk of patient harm resulting from falls. This is in our hospital, for every admissions, we are doing the fall risk assessment, bed sore assessment and DVT risk assessment. In fall risk assessment, we are using the Moore scale. By evaluation could include fall history, medication and alcohol consumption review, gait and balance screening and walking aids used by this patient. According to the Moore scale, if the score is above 40, the patient is at high risk for fall. So the staff should start the all fall preventive measures like training to patients and patient families, not to leaving bed without any help, nurse call bell system and frequently used objects are placed near to the patient. Then bed height is fixed at the lowest level, all side rails in the up position. Instruct the patient to wear non-skid footwear. Unused equipment is removed from the room, proper lighting. Then 7th goal, the clinical alarm safety. When the clinical alarms ring, the staff should check the patient condition to see that the patient is conscious and breathing. If not, immediately start the BLS and ACLS protocol. If patient stable, look at the if patient is stable, look at the monitor to see that parameters alarming. Since the alarm and continue to analyze the monitor, the reason for alarm. Check physical parameters in the patient. Check alarm levels. If level are incorrect for that patient, we reset the alarm. Then in case the alarm is genuine and patient has a problem, support the patient and obtain help from the physician. Then 8th goal, improve the healthcare equity. It is identify an individual to lead activities to improve healthcare equity, assess the patient's health related social needs. The patient safety is always starts with me. Thank you for listening.
I would like to share few points regarding microbiological diagnostics and patient safety. Microbiology Lab, the aim is to highlight how clinical microbiology laboratories can contribute to patient safety. Microbiology laboratory deals with prevention and control of infections in hospital, diagnosis of infection, treatment guided by antimicrobial susceptibility, antimicrobial stewardship, and quality assurance. Diagnostic error. The most common diagnostic errors include ordering inappropriate tests, wrong interpretation, failure to follow up and render. Delay in treatment after diagnosis results in increased cost, prolonged treatment. According to Joint Commission report, diagnostic errors result in death or injury to 40,000 to 80,000 patients per day globally. In US, these contribute about 10 to 20% of patient death annually as observed on autopsies. This incidence is not adequately documented in our country. There are two aims in microbiology. One is diagnosis of infection, then hospital-acquired infection, prevention and control. Microbiology laboratories are at the forefront of detecting emerging pathogens, newer antibiotic resistant trends, identification of outbreaks. High quality institutional clinical microbiology laboratories provide good patient care, outcome, and are cost effective. How to provide safety to patients? First one, in diagnosis of infection, quality report can be given by preventing errors. These preventing errors, there are three types: pre-analytical, analytical, and post-analytical. This was already mentioned by Dr. Jitesh, so I don't want to go in detail. But as far as microbiology is concerned, specimen collection is more important because contaminants is great headache for reporting microbiology reports because contaminants is present everywhere. If the sample is not collected, if it is improperly collected, the contaminants will grow. Culture media may not know which antibiotics to be grown. The contaminants grow and it will greatly interfere reporting, which may affect doctors to treat the patient. For example, for blood culture, patient may be in the critical ward. If it is not collected, the contaminants present in the skin may grow. So it is very difficult to treat the doctors, especially for MDR strains. Then rapid test. For example, gram stain is more important for the patient, for doctors to treat the patient empirically if it is gram negative or gram positive organisms. The precise culture report and sensitive reports help physician to choose antibiotic and prevent emergence of MDR strains as well. Back. Early detection of etiological agents of hospital-acquired infections and their antibiotic sensitivity help physician to treat critical ill patients greatly. Thank you.
Good afternoon. I take this opportunity to thank Dr. Renu Prasad for giving us the opportunity to celebrate World Patient Safety Day today in our hospital so that the safety culture will be re-established and all of us talk the same term and we are in that safety culture. Thank you so much. And I'm sure it's a wrong time. Now it's 1:30. I will make it short. So if you're in a plane, you have a chance that 1 in 10 million times you have a chance to die. 1 in 10 million times. But if you're in a hospital, you have a chance 1 out of 300. It's not due to the illness what we have. It might be due to a harm. error that occurs in the hospital. So patient safety worldwide is a very, very important thing. So all of us, we have to focus on, especially in the hospital setting. That's why we celebrate every year, and this year we have come with an idea, the WHO has come with the idea of improving diagnosis for patient safety. Hardly 30 to 45 minutes a doctor meets a patient. Whether it's, if it's an OPD, it's 15 minutes. But as nurses, we are with the patients for a long time. So as nurses, it's our main role in bringing up the safety culture in the hospital. So today our topic is going to be the nurse's role in improving diagnosis for patient safety. These are the types of diagnostic error we can have. So there can be a delayed diagnosis or a refused or an incorrect diagnosis, or it can be a missed diagnosis. All three events will ultimately end up in harming the patient. So in US, as Dr. Anita already mentioned, the US statistics shows that 1 out of 20 errors are due to one of this diagnosis, due to diagnosis. So it's worldwide, in India we don't have record of such errors in diagnosis. So worldwide it is an alarming thing to take care of proper diagnosis for patient safety. So how to go about, or who are all responsible for this improving patient safety, improving diagnosis for patient safety? So first and foremost person is the patient. The patient itself. Half of the, when the patient comes to us, so many things they refuse or they don't tell the proper history to us. Like for example, a mother with a newborn would have given some medication outside or how many of you have come with such problems? But they never say. Patient will come with diarrhea, now so many problems. There will be a lot of tests running on that patient, and everything will come out as normal. So first and foremost person who is involved is the patient itself. So the correct problem has to be told to the doctors. And secondly, it's the health workers. We play a major role. And also, when we talk about health workers, the safety is everybody's culture. And everybody, all of us, everyone, including the students, everyone, the cleaner, the attender, everyone in the hospital is responsible for patient safety. And that's what we say. Everyone along the way has a role to play. The facility managers, policy makers, civil society also has a major role in patient safety. So as nurses, these are the steps we have identified. So these are the steps. The first thing and the foremost thing is a patient history. As nurses, collecting history is very, very important. Not only as nurses, as clinicians, as anybody, the proper history has to be obtained and then forward to the diagnostic test and interpretation. Like some few points I want to focus for my dear nurses. That is, especially when a patient comes with fever, we say fever. Fever is raising temperature, body temperature. But is it intermittent fever? Is it an evening rise in temperature? Or is it a early morning rise in temperature? Is the fever with chills? So history will give a chance of proper diagnosing. So proper history taking is very, very important. This can be done only if we have adequate knowledge. Then comes the diagnostic test and the interpretation of it. So sometimes when you do an EABG, If you do not know how to interpret the values of the reports, what we have in the hand, it is very critical or dangerous for the patient. So we have to know and interpret the findings. Then the communicating results. It's very important we have a culture that every telephone will have a critical value book in the ward, right? So any abnormal values critically alarming the patient will be noted in that notebook, and it will be read back as read back policy. The read back policy also, it should be like 1.0, 2.0, 2.5 TWO. So try to be very clear. The verbal orders, what we receive through critical values, mostly we receive through phone. So it has to be read back and immediately taken to the treating clinician. And finally, the diagnosis, treatment and evaluation. And this has to be, it's an ongoing process, and it has to be, and this is how we cure the patient. So by these steps, if we follow, we can help the patients in getting it right and by making it safe. Some of the tips which we want to share today is keep up your knowledge and skills up to date. There are a lot of new techniques, technologies coming up. A lot of various diagnostic things have come up. So keep up your knowledge, then complete the picture. Like if you're drawing a blood culture, complete the picture of stating the antibiotic, whatever the patient is on, so that the culture and sensitivity report can be interpreted properly. And also the temperature of the patient, if needed, has to be mentioned, has to be reported in the, and think critically and self-reflect. Okay, always try to, and be aware of biases. Here we can say a lot of, naturally we tend to have a lot of biases or prejudice or overshadowing of diagnosis. Oh, I saw a patient like this, so this patient might be this one only. So the way of investigation, everything goes in another one line. We might miss out various other diagnoses. So overshadowing of diagnosis has to be avoided by avoiding biases. Then consult the peers. So if you have any doubt in the regarding microbiology lab, call and ask what tube to take, how much ml to take, what should be done before this. If you have any doubt regarding radiological procedure, call radiology department and confirm, ask, or ask your seniors, and do not make any mistakes. So consult peer. And today we are in one room, all of us, all various departments are here. So we need to develop the communication and consult each other and improve, try to improve continually. Learn new things and improve continuously. So today in this group, inside this room, we have a lot of experts insights we have learned, and we made a networking opportunity. We can communicate with various departments, and we can go with the best practice. So that's what you gained due to your participation. So a small request for a change is an open culture, a just culture, open culture. If there is some error, try to bring it out. Try to report it to the management, because it's not about the person who is doing the mistake, the people who is involved in the mistake. It's about the system, or it's about why and the lack in the system that causes the error. So try to report the incidents. Then a just culture. Be frank. If there's an error, try openly discuss with your superiors, tell it out, bring it. A just culture has to be there. If yes, yes. If no, no. Then a reporting culture. Anything, everything, try to report. You receive a critical value, don't keep it for yourself. Immediately report it to the treating doctor. And a learning culture. Try to give importance for education. Keep learning. Attend lectures and keep improving our up-to-date knowledge. And I want to end with a famous quote of Mr. Thomas Edison. He said, "It's not that I have not failed. I've just found 10,000 ways that won't work." So I just want to end my lecture. Thank you all for this wonderful opportunity. Thank you.
Guest with us, and she comes from Dumfries, UK, where she is the clinical lead in surgery. So she came for the MRCS exam as an examiner at Trivandrum, and she's come from there, and I brought her for this meeting. Thank you, Maria.
And good afternoon, everyone. And it's a real honour to be invited by Dr. Devaprasath to speak, to attend here and to listen, first of all, and then to say a few words at the end on what is this very important day of World Patient Safety Day. World Patient Safety Day, get it the right way round. All of us are very fortunate to be in a position to look after patients, to work with them, to help them, and to do what we do to them, because some of the things that we do to patients are really very significant. And so it beholds all of us to work together to do the best that we can to keep patients safe. And today, over the last hour and a bit, we have heard many good points about how to do this. Primarily, the importance of teamwork and the importance of communication. And I think one of the strengths of the presentations that we heard today was that they did come from the multidisciplinary team, because we all must work together to keep patients safe. In the UK, clinical governance is a very significant part of our day-to-day life in the hospital. And I was heartened, pleased, or impressed to learn that it is also plays such a big role here in this hospital. And I think that's a credit to your founders and to all the staff, all of you here, for that. As part of my role, I'm involved in the clinical incident reporting system, or serious adverse event reporting system. And I know from Dr. Devaprasath that you have a similar system here. The incident that is most reported, despite all the work that has been done to try and prevent it, is still falls of the patient. And so the talk that we heard earlier today about preventing falls is very important. Clinical infection is also something that features prominently. And I've been hearing and impressed by the fact that not only do you have 2 clinical infection nurses here, but on each ward there is a nurse identified as a clinical infection controller, yes, which just shows how seriously that is taken here. We must also remember, though, that it is up to all of us also to focus on clinical infection, not just the controllers that are there. Communication is the other big area that comes up in our clinical reporting system. So communication between patients and doctors, patient and nurses, but also communication within the multidisciplinary team and communication doctor to doctor. It's a very simple thing, but it's also possibly the hardest thing to get right. The focus of the day today is on improving diagnosis, and communication and teamwork has an important role to play in that as well. It is not just up to the doctor taking the history. As we heard, the nurses may come up with vital bits of information that the doctor missed. The cleaner who's in the room sweeping the floor and having a conversation with the patient may come up with a vital bit of information to help with the diagnosis. So again, that just emphasizes the importance of teamwork in getting to the correct diagnosis. And actually, as a junior doctor, I learned very quickly, probably within the first couple of months, that the way that I could be a better doctor was to listen to the nurses, because the experienced nurses often could pick up the little bits of vital information either from a patient's history or from their physical signs that would help reach the right diagnosis. So never forget the important role that all of you play in that. So thank you once again for asking me to be here today, and I've really enjoyed all the presentations. And get it right, keep it safe. Thank you.
Good afternoon to all gathered here on behalf of Dr.Jeyasekharan Hospital. Being Assistant Nursing Superintendent, it's a great honor and privilege to propose the vote of thanks on Patient Safety Day. Let me first thank God Almighty for making today's occasion a grand success. First and foremost, I take this golden opportunity to thank Dr.Renu Devaprasath, Medical Administrator of this hospital, for initiating and guiding us to celebrate World Patient Safety Day. She always emphasizes patient safety first, progress must, and screwing us in all aspects of patient safety. We assure ma'am that we'll ensure the safe practices in our hospital. A safe hospital is a happy hospital. Thank you, ma'am. I express my deep gratitude to the management and the trustees for being the driving force behind this whole process. I extend my sincere thanks to Mrs. Beena Sabu, Correspondent, College of Nursing, Ms. Anju Sabu, Head of IT Department, for your presence and participation despite of your busy schedule, ma'am. Next, I would like to thank Dr. Maria Buse, her Clinical Head in Surgery, Dumfries, UK. We are proud to have you here, ma'am. Thank you, ma'am. Next, I would like to thank our chief guest, Dr. Anita Alex, Associate Professor of Microbiology from Kanyakumari Government Medical College Hospital, Asaripalam, who honored this function by sharing her valuable ideas in improving patient diagnosis for patient safety. Thank you, ma'am. Next, I would like to thank Dr. Subbian E., Physical Medicine Rehabilitation Physiatrist of our hospital. Your speech towards standing up to prevent falls was very informative and helpful in preventing falls. Your topic itself was a take-home message, sir. Stand up to prevent falls. Next, I would like to thank Mr. Denzel Anthony, COO of our hospital, for your support and encouragement in conducting this program. Next, I express my sincere thanks to Dr. Jitesh, pathologist, lab director of our hospital. The information you shared about the diagnostic process of patient samples was very informative. Thank you, sir. Next, I would like to thank Mr. Kingston, in charge of radiology department. He told 1960s நம்ம hospital every day is the patient safety day. சொன்னீங்க ரொம்ப பெருமையாக இருந்துச்சு. It's a professional diagnosis itself. Patient stay குறைக்கும்னு சொல்லி it's really informative and thank you, sir. Next, I would like to thank Mrs. Maria Lisha, patient safety nurse. Your topic towards WH patient safety goals is very informative and important in patient care. Next, I would like to thank the Mr. Nelson, the speaker, in charge microbiology. Your speech regarding diagnostic errors delays the cost and the prolonged treatment. As per our hospital data, I am proud to say that diagnostic errors of microbiology lab in the last 6 months is nil. Next, my sincere thanks to Mrs. Hepzi Hararik, Deputy Nursing Superintendent of this hospital. Ma'am, you emphasize the nurse's role in improving patient diagnosis, in patient safety. Your information about the cultures, various cultures in patient safety is very informative. Thank you, ma'am. Finally, the support staff, Mr. Nagaraj, Mr. Uday Kumar, Mr. Jocelyn, Mr. Padmanabhan, and volunteers. You all behind the scene efforts have ensured the smooth running of today's program. We deeply appreciate your hard work and dedication. Last but not the least, I thank all the hardworking doctors, staff nurses, students for your presence and cooperation in making this day a grand success. Once again, I thank one and all present here for patient listening. Thank you.
पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे